Hello. I'm here doing a little mini series of some shorter videos where I am answering some frequently asked questions that I get from viewers of my channel. And one of those questions is whether I tried using a pessary or any other type of device before choosing to go the surgical route for repairing my pelvic organ prolapses. So, assuming you haven't had time to watch all 25 of my videos, I am 3 years post pelvic organ prolapse repair surgery. I had repair for cystocele, rectocele, enterocele, and vaginal vault prolapse. So pretty much all of my lady bits were hanging out right there at my vaginal opening. I am what they call like third degree prolapse. So mine were not hanging out of the vaginal opening. They were just right there where, I could see them with a mirror. But I have heard from some women, it just breaks my heart, who have these stories of these organs literally falling out. A woman reached out to me the other day and she said, I'm about to have surgery. I love to go bike riding, but every time I swing my leg up over my bike, then her bladder is just falling out down there and she has to shove it back in. Oh my goodness, ladies. That is just so disheartening to me. Number one, you should not be living like that. And number two, my heart just goes out to you because I know the amount of pain and pressure I was feeling down there. And I can't imagine what that feels like from your perspective. So, no, I did not. If you have listened to my channel introduction or any of my other videos, you will know that my prolapses were discovered when I was 3 months postpartum with my last child. I knew something wasn't right down there. I was initially dismissed by my gynecologist as, oh, this is all part of delivery, recovering from a vaginal delivery and everything will go back to normal. Well, I just knew that wasn't true. I could feel it down there. When I kind of explored to figure out what it was, I had a ton of pressure. I was having back pain and hip pain, which I later learned was from the pressure of all of those organs pressing against my various nerves in that pelvic floor area, which are all connected to your hips, to your spine, down your leg. That pudendal nerve specifically runs all the way down your leg, into your back, into your hip. And so when you have organs down there applying pressure, it's going to cause pain in all of those areas. Sex was uncomfortable. I felt like I had a very full tampon down there all the time. I was having like vaginal odor, which was not normal for me. And again, I got out a mirror and I could see a ball of tissue in my vagina. So essentially I went back and I said, this is a problem. There is a thing. Sure enough, at that point, he said, oh yes, I believe that you have, that's a cystocele. That is your bladder prolapsed. Which was scary enough to me at 3 months postpartum and 37, I believe. But I knew that I was facing a surgery to repair, or to fix some stress urge incontinence. So I was kind of like, no big deal. I'll get my stress urge incontinence, my stress incontinence fixed where I'll stop peeing myself when I cough, sneeze, laugh, jump, cough. And we'll fix this whole cystocele problem while we're at it. I got a first opinion. You can go back to my How to Choose a Surgeon video to hear all about that. Was not impressed with her. Thank goodness I didn't just trust her advice. Went to a well-respected, honestly world-renowned surgeon in my area. And he said, you got a lot more than cystocele going on. He's like, pretty much everything's falling out down here. And here's what we need to do to fix it. So he did say we could try some stopgap measures like pessaries, whatever. But I'll be honest, I was 37. I had a 12-year-old, a 3-year-old, and a newborn. I had a husband who does shift work. He's gone for 48 hours at a time. I am frequently on my own, not a lot of family support. I was very active. I enjoy working out. I was always picking up my kids. And I just hadn't heard anything good about these pessaries. Like, they just don't work. They fall out. They need replaced. I just didn't want to do it. And I trusted the surgeon and was confident in his work that what he was telling me was likely to be true about what he could do with native tissue repair and them being lifetime repairs. So I was not going to end up back on his operating table. This was going to hold up for a long time, and it was going to allow me to live a normal life, right? Like not dealing with things falling out and having to have a pessary replaced. I had done tons of Kegels since my first delivery, which is how this all started. If you watch my channel intro video, it did not work. It just did not work. And I'm not saying that it won't work for all women, but Kegels cannot fix a prolapse. When your organs are falling out down there, I don't care how much you try to tighten those pelvic floor muscles, it's not going to stop it from falling out down there. And if one organ prolapses, then you're at a greater risk of other organs because of gravity and everything is shifting around down there. I'm not a person who quickly jumps to surgery, but in this case, it was really the only thing that made sense to me. I can see a woman who's maybe past her childbearing years, isn't sexually active, isn't very active, period, maybe wanting to try another option, but I did not. Again, had done a ton of Kegels before that last baby, knew it wasn't going to help with my organs falling out, didn't bother, did surgery, and yes, it was a rather difficult recovery, but I am 3 years post-surgery now, almost to the day, and I will say it was 100% worth it. I would recommend it to a friend, 5 stars. The recovery is rough. I'm not going to lie about it, especially if you have it done the way that I did with native tissue repair. I had a suprapubic catheter from the way that my stress incontinence repair was done with a TVT mid-urethral sling, and I also had a vaginal hysterectomy at that same time. That ultimately put me into hormone failure, and so the last 3 years I have now been on hormone therapy, basically in menopause prior to the age of 40. None of that has been enjoyable. I have a whole video I made probably 3-4 months ago about reconsidering a hysterectomy if you're young like I was. They could have fixed my prolapses without the hysterectomy. It just would have increased the likelihood I would be back for more surgery, because the more organs you leave in, the more there is to prolapse, the more gravity there is. And I kind of was convinced that the thing to do was hysterectomy. They had assured me that my ovaries were staying in, so I wasn't going to have hormone issues. But I should have done more of my own research on that there's at least 15% of women that have a hysterectomy with ovaries intact, they are not removed, that go into nearly immediate ovarian failure. Or it's a slow process, kind of like mine was. But at about 18 months post-surgery, I was on a hormone regimen because my ovaries were not doing what they should anymore. So, that's a whole nother video. But as far as having prolapses repaired surgically, I totally recommend. Ladies, stop living like our great-grandmothers had to live when there really was no other way to fix it. We have surgical options. Find yourself a good surgeon with great reviews. Get multiple opinions if that's what you feel like you need to do. If you're willing to come to the Midwest, to the St. Louis area, I will happily share the information about my surgeon. He has women fly in from literally all over the world to have him do their surgery or fix the mistakes of surgeons that have worked on them previously. So there is an email on my channel bio, but it is personalprolapsestory@gmail.com. If you email me, I will happily give you his information. I just don't share it on my videos because I don't have his permission, and I don't know. It's just not something I'm comfortable doing. But anybody who emails me, I will give you that information if you want to know that you are going to a really good surgeon. But have the surgery and get on with your life. Stop. If you got things falling out, ladies, you're in pain, you're uncomfortable, you're embarrassed, you probably have like odor issues going on that you don't like. I'm sure your sex life can't be that great. Do something about it. You don't have to live like that. I don't care what age you are, you don't have to live like that. So anyways, that's my advice. I did not try pessaries or anything else. I went straight to surgery and I don't regret that.